We're back with Dr. Michael Eisemann, one of Houston's most esteemed plastic surgeons and owner of the Cosmetic Day Surgery Center. Dr. Eisemann, welcome to the show.
Nice to be here.
Let me ask you first of all, the baby boomers are getting to the age now where in order to stay competitive they may have to have some work done, some aesthetic cosmetic surgery. Do you see a lot of that in your practice?
It's very common, Dominic, as you know, that we make conclusions about people based on their appearance. We call these stereotypes, physical attractive stereotypes, and there's no doubt that the attractive person enjoys privileges that are not given to many other people, even based on their training and experience. So it's a privileged group to deal with, and basically we're talking about people who are normal in appearance and basically enhancing their appearance. It's basically important for their self-image, and they derive more self-confidence, and it's important for them to look good, obviously, to other people, but probably it's more important for them to look good for themselves and to themselves. I
think most people, when they think in terms of plastic surgery, I think they've thought about women doing it. Are men doing more of that now?
It's a lesser number, but it's about 20%, and it's growing. I think people, and men particularly, realize that there's a certain reality in their job market. They have to look good, and they have to feel good about themselves for their self-image and self-esteem, and confidence is important, and you derive that by knowing and feeling you look as good as you feel.
What kind of surgeries would men have? And women, I want to talk about that too, but I'm just curious.
A common operation that they would typically have is a blepharoplasty, which is an eyelid procedure. The downtime is short in that procedure. Certainly hair transplantation is becoming increasingly common these days with the newer techniques of transplanting 1 to 8 follicles from one part of the scalp to another, and it gives a much more natural hairline, avoiding the cobblestone or cornrow effect that typically you'd see in punch grafts that we've done in the past.
What about, I understand that you do this in your office. You don't hospitalize these people.
Well, most of the surgery, the aesthetic surgery that I do, is done in the office under intravenous sedation. We find that this is safe. It is also a certain element of privacy is derived. It's certainly very economical. It's certainly at least a half of what it would be in a hospital. And the patients seem to enjoy it. There's a continuity of care that they expect and receive, knowing that the same people that they're seeing before the surgery, they're seeing during the surgery and after the surgery. So it works out very well.
How long, since you have it there in the office, how long are they out of work?
Well, it depends typically on what particular procedure you're talking about. Blepharoplasty, some of the people go back in several days with some sunglasses. Stitches would come out quite early, in 4 to 5 days.
What about confidentiality? Is that a big problem? I think most people probably are concerned about other people knowing that they're having it done.
It is, and that's one of the reasons why we've established the Cosmetic Day Surgery Center. Confidentiality is one of the things that they can expect and receive from the center, and it's worked very well, and it's received very well, and I think it's probably one of the best internal marketing techniques that we've had. We haven't had to sell it; it sort of sells itself. People are very enthusiastic about doing it in that setting rather than having a general anesthetic. But of course, it does require a certain skill to do it, and a certain temperament from the point of the doctor and the patient.
You hear a lot about this liposuction. I think Donald Trump even had liposuction done.
Liposuction?
Liposuction, yeah.
In men, generally, there's certain areas of the body where we call depot fat which is very difficult to mobilize with dieting. When you diet, and this fat is not mobilized, it stays there, and you become very gaunt in other areas of the body before you lose it where you want it. In men, it's generally in the neck area, in the breast area, in the flank. In women, it's other areas in the trunk. And they would again lose it in the face perhaps before they would lose it in the areas where they want it.
I've heard Houston is one of the most popular cities in terms of plastic surgery.
It is. The city really has a long tradition, beginning with Dr. Cronin and Dr. Hardy in Houston, and it's very, very popular. There are 3 residency training programs. There are probably as many residents trained here in Houston as there are anywhere in the United States, even for a smaller city.
What's the average price for these types of surgeries you do? How much money are we talking about?
It ranges anywhere between $1,000 and $4,000 to $5,000 for a procedure. Facelift is typically one of the more high-end items, and liposuction would generally be one of the lower-end items.
Interesting. Thanks for being on the show.
Sure.